we have reached the point where we have understood that if we want to get a good or long lasting or a permanent treatment of erectile dysfunction, we have to treat the arteries and we have to get a new fresh artery. How do we do that? Number one, we use shock waves. Shock waves are nothing, they are pressure waves. They go inside the penis, they will break the muscular tissue of the soft of this arteries, that is soft muscles of the arteries. Once they are broken, new muscle tissue regenerates and they make the arteries elastic again. That is number one. Number two process is by pushing P shot. Now let me tell you what is P shot. P shots are your own platelets. We have the platelets which has the ability to develop new arterial channels, and these platelets, they work, they will create new arterial channels and new arteries are formed. Now this P shot, one is a process of injecting platelets, and we know that the platelets work by their growth factor inside the platelet. Now, platelet contains prostaglandin growth factors, insulin-like growth factors, and others. Now, these growth factors, once they enter the penis, they start developing absolutely new pathways for the fresh new arteries. This second technique is a pre-shot, but this is called growth factor concentrate or GFC injections. So they work excellent. They work in very short time and the results are outstanding. And most important, they don't have any side effect. It takes about 2 months to complete this treatment course and the results are very long lasting. So I our job is to give you the right information, right uh, knowledge about the treatment subject, because after 50 what happens, people start taking medicines, and these medicines are of the sildenafil group, where the body will try to pump in more blood inside the penis, but we know that the arteries cannot expand, they cannot take up more blood, they have a limited capacity. So the result is unsatisfactory erections or unsatisfaction in during sex. So that is what happens, and the people, what happens after getting a problem of erection, they start looking for different partners so that they get higher amount of excitement and are hoping for a better erection, but that never comes. So the only process we have found is the long lasting or good repair of the arteries or putting up with the new arteries. Once the new artery comes in, your sexual health becomes very young and you will get a good satisfaction out of it. Thank you.